Ministry of Health has directed all the 14 regional referral hospitals in the country to enforce cost sharing for access to the services at the Computed Tomography services, commonly known as CT scan, with the government for the extended lifespan of the machines. Dr. Diana Twin, the Permanent Secretary, Ministry of Health, in her letter dated 2nd of June 2023 to all the executive directors of the National Referral Hospitals and the directors of the regional referral hospitals in the country, says this is to ensure timely purchase of supplies for the machines, as the number of partners that have been helping the country keep dwindling in the sector. She therefore directed an immediate implementation of the guidelines on cost sharing for the CT scan services only with public as guided by the ministry. Meanwhile, Dr. Alex Santema, the hospital director of Regional Referral Hospital, says they plan to effect this directive come 1st of July 2023 as they have impact on public awareness to this change.
It was realized that it is necessary to have these services sustained, and the services don't need to be interrupted by not having the consumables, or the machine has broken down and we're waiting to repair it. This has happened with some equipment before, like x-rays and so on. So for that matter, it has been decided countrywide that there should be a harmonized cost sharing for these services.
Dr. Alex further explains that the payments have been categorized based on the gravity of the complication a patient is diagnosed with.
Contrast material is quite expensive. So for procedures where there is going to be no contrast, both children and adults will pay 120,000. And for procedures where there's going to be a contrast, both children and adults will pay 150,000. And there are some very complicated scans which are done in some few facilities, maybe the national hospitals, but some regional hospitals may do them. Those ones will cost more than 150, but not more than 200,000, depending on the assessment of the procedure and what it will require.
In March 2022, Ministry of Health procured 14 CT scan machines and delivered them to the various referral hospitals, including Arua, Mbale, Jinja, Soroti, Fort Portal, Mubente, Masaka, Hoima, among others, that offer electronically express services for improved service delivery in the health sector. However, some members of the public welcome this message with mixed reactions.
That the transport alone from the rural setup is still a challenge. Then where they should be given a duration, a period of maybe 3 to 4 years, so that the people can set up their mind that now, because of A, B, C, D, we are going to cost share.
Will be extorted money, people will be cheated because they will believe that when you come to the hospital, you need to pay some amount, you need to cost share. So, because of naivety, because of their ignorance, somebody will take advantage of them. So, that is another way to say that we don't need cost sharing. Somebody should know coming from home, from the back of his mind or her mind, that he's coming to take the medicine for free, or he's coming to get free treatment. But now when you come here, when you don't know what happens here, definitely somebody will take advantage. Now, it is upon the hospital administration that to put strict measures of how to curb some of these things that may happen.
According to Ministry of Health, the funds shall be collected directly in the bank accounts specifically for CT scan services, which will be controlled at the center, while persons seeking for the services shall only be allowed to present receipts at the facilities to avoid cases of extortion. Frederick Tramadri, West Nile TV, Nilecast.